This is the session, for those of you that want to be sure that you're in the session that you want to be in, on paid family leave, looking at the various campaigns in the New England states, the successes and challenges. So if that's what you were looking for and you're in this room, well, you're in the right place. I'm Representative Mary Gile, and I come from the state of New Hampshire, and I'm joined today by 3 senators. I feel really important. And Senator Gayle Goldin from Rhode Island, Senator Karen Spilka from the state of Massachusetts, and Senator Beth from the state of Connecticut. And it was so interesting to find myself on this panel because while I have not had previous experience with Senator Spilka, Senator Goldin and I both went to McGill University, which is kind of an interesting coincidence. And Senator and I are both early childhood fellows appointed by the National Association for
State legislators.
the state legislatures. I was going to say for the education of young children. I got too much stuff in my head.
We got that too.
Yeah, right. So we've worked together in different settings, and so it's very exciting to be here. And my plan, or the plan, is just to share with you what is going on in the New England states by way of campaigns, and then for each panelist to take about 10 or 15 minutes to do that, and then to open it up for questions. So if that's okay, should I shorten it to 10 minutes and not 15 minutes?
We can do 10.
All right, no, okay.
Always.
All right. And I would like to start with a success story. Those of you that were in the previous session heard quite a bit about Rhode Island. Well, Rhode Island already has a paid family leave system, and much of it due to the energy and vision of Senator Goldin. So I asked her if she would be willing to begin. Senator Goldin.
Thank you. So how many people in the room raise your hand if you were here in the last session so I know how much to. Okay, just making sure you didn't switch track. I know, but everybody might not see? She admitted to not following the rules. I mean, good for you for breaking the rules, but so as mentioned, Rhode Island is as we talked about in the previous session, as a temporary disability state, and which means that since 1942 in Rhode Island, we were the first state in the country to create a system where people paid a little bit into an insurance pool, and from that knew that they'd be able to get their wages replaced or part of their wages replaced if they needed to take leave from work in order to care for their own selves. And then in the 70s, that included pregnancy as well. And since the 70s has included pregnancy as well. It is my understanding that passed the Rhode Island legislature in 10 days in 1942. So if you can imagine ever doing anything in 10 days that had decades-long impact, it would be amazing to have happen now, but that is not the story of how we expanded it to include family leave. And so I wanted to talk a little bit about both the how we got there and where we're going from there, and why it is that just because we're the state with temporary disability insurance, some of that made it easier in some ways, but in other ways, as you heard from Barb and Helen this morning, it actually constrains what the policy is in some aspects. And so I want to talk a little bit about that, what that is as well. But mostly what I really want to reinforce, if the one thing you take away from me today, is that this movement needs you. This isn't about us up here as legislators. We cannot get anything done individually. Well, maybe they can. I suppose I shouldn't speak for all of you. But historically, people can't get anything done as one person. This is really about a movement, and it's about people working collectively. And that means each and every one of you have a part to play in this process in your own state. And woven together, that is how we will get to national change. So I want to tell you a little bit more about my story to get you to that place to realize that there's nothing magical about what happened in Rhode Island. It was just a coordination of a lot of effort of a lot of people working together. So in the early 2000s, I became a mom through adoption in 2001. And as we had talked about, the temporary disability insurance does have time associated with the disability associated with pregnancy and I use that term that way because it's framed that way in the law. But, so you could have access to that time out of TDI 6 to 8 weeks with wage replacement for a pregnancy. But for somebody like me who was a parent through adoption, there was 0 leave. I had, in that same year, actually had been in a freak accident, where I broke my back and had already been out of work and basically had blown my FMLA leave. I had thankfully had TDI, so it wasn't as huge of a hit in our family. But I didn't really have a whole lot of options when this opportunity became to be an adoptive parent. And so I got angry and I thought, oh my God. And first I thought, well, this is my own fault. We should have planned better. We should have expected that some freak accident could have happened to us. And, and then I started realizing, wait, this isn't just about me. This is actually a systemic issue because you didn't need to have that freak accident. People become parents every single day. And we have a society set up to make it harder to maintain yourself in the workforce because we don't have things like paid family leave and affordable child care or paid sick days to make sure that you can stay home with that child when the kid is sick or you are sick yourself from the 8 to 10 illnesses that child will have in the first year of life. So, I started talking to people, and I went first to an organization that works with adoptive families in the child welfare system in Rhode Island. It's called Adoption Rhode Island, and I went to the executive director, did not know her at all. I said, hey, I realize that we have this TDI system, and it's I can't access it, and that seems really unfair. And we started talking. She said, you're right. Let's start talking. We spent probably about 3 or 4 years building connections with a bunch of different organizations, working on legislation in the state house in an era where we had a Republican governor who there's no way was going to pass anything that was an expansion of TDI. And it was a really interesting experience. And I bring that up, that it was not politically viable at the time to get this passed, because I think it's important to know in this current era that it feels like that we might not be able to get exactly what we want accomplished. But that doesn't mean you aren't laying the foundation for it. And so a few years later, after having many conversations, many businesses changed their policies in Rhode Island that had been part of these conversations, added in some slightly better benefits than they had had previously, things like that. We finally came back in about 2011. I joined with something called the Women's Policy Institute, which was part of Women's Fund of Rhode Island at the time. In the Women's Policy Institute, I came there as a member of that cohort and said, hey, had been working on this. I think that this is really a gender equity issue, but it is a working family issue. It's something that disproportionately affects women. But it's something that will be an improvement for all of our families in Rhode Island. And so those women who all were just joining me in a training program, all worked different jobs. There was people in IT and communication, so many people who had never done anything like this before at all said, okay, let's take this on. And, it was really through the sheer force of that energy of people figuring out, okay, who do I know? What kind of resources can I bring to this? What kind of skills do I have? That lay the foundation again for starting that advocacy. And then I ran for office and I made this one of my top priorities to get done. I was able to get the temporary caregiver insurance passed in my first year in office. And while that was incredibly rewarding, the bill that passed the Senate was much stronger than what ultimately was passed out of the House and what we compromised on in order to get to the governor's desk. And so since that point, I have been remarkably honored to have the work of Barb and Helen funded through Women's Bureau and other funders in the state really looking at ways that we can improve, strengthen, and advocate for the policy in itself. And one of the things we know, you really don't need research to know that if you're living on minimum wage, 2/3 of minimum wage is also not a living wage. But the research shows that it's a little bit more difficult if you're a low-wage worker in order to access this leave because it's still an economic hardship for you. And you're more likely to think that you're going to not have that support in your job. So those are really important, critically important issues, and that's why it's important to make sure people get across that they're paying for it and it's a job protected leave. And we also need to make sure that the leave is longer. But one of the things that we really can do, and this is the real challenge of it being built off of TDI, is TDI within it had this formula that has been changed a little bit over the years. But essentially, people pay into the TDI system a portion of their wages, and we have that capped. A cap that's kind of tied to average weekly wage, and it's a formula that I can't even really begin to explain, other than it means that you're only receive a premium on the first about $64,000 of money that you pay in, which means if you earn more than $64,000, you are not paying the same proportion of your income into TDI as somebody who is a lower wage earner would. And so I've introduced legislation, will continue to advocate for legislation that will change that wage base and say, hey, everybody should be paying into it. And that would actually decrease the rate and allow us the opportunity to give lower wage workers a higher wage reimbursement, so that those people who have least financial capacity and the least access to existing benefits within their own employer would be able to have access to that leave. It's also going to lengthen the leave. And it'll expand the definition of family. When TCI passed in Rhode Island, we had the most robust definition of family in the country out of California, in New Jersey. And then 3 weeks later, California expanded their definition of family beyond what Rhode Island had done. So it was a very narrow margin of excitement there. But the reality is, it was great for the state of California that they did that, because the reality is the way we have defined family starting from 1993 on and codified into law and FMLA is a fairly narrow definition of family, and doesn't reflect the way that we caregive for people in this country, or where we live in intergenerational families. And so we really need laws to have as broad a definition of family when you're talking about who you'll care for, because my definition of who is related to me and your definition might be very different. And so we have seen real innovation in paid sick days laws that have passed here, and now Washington State and Arizona have some extremely robust language on paid family leave, and I fully intend to make that happen into our, a family definition into our paid family leave. Am I done talking?
Well,
So am I wrapping?
Yeah, okay.
So I guess I'll just conclude by saying that there are real opportunities for you to get involved in collective work. The advocacy of getting this passed in Rhode Island involved labor unions, it involved small businesses, it involved healthcare providers, the American Academy of Pediatrics, it involved Kids Count, it involved senior organizations. We have one called Senior Agenda Coalition, involved the AARP. It was really a combination of a lot of people who understood that working families needed a break, and that this was a really, really good way to do it. So I encourage you to get involved in whatever way you can. And as your legislators are proposing this legislation, realize that a state-run insurance pool like we have in California and Rhode Island is the most cost-efficient way to do it. So please hold your legislators accountable to that too. Thank you.
Thank you, Senator Goldin. And I think that Massachusetts, New Hampshire, and Connecticut are all sort of, pardon? Oh, that I think that Massachusetts, Connecticut, and Rhode Island and New Hampshire are all sort of works in progress. So the campaigns are at different levels. So we'll move then to Massachusetts to share with you at what stage they are in their campaign.
Thank you so much. Welcome, everybody. I was not here earlier, so I don't know what went on in talking about paid family leave. I was actually on a panel for a tech conference, so I'm taking that hat on and putting this hat on, that hat off. I caught the tail end of Elizabeth Warren, and I have to say, not only did she fire me up, but in general, and about where we are as a country, but also as a state of Massachusetts. So I wasn't planning on adding some of our great accomplishments this last session, but for me, this past session, or the one that we're wrapping up, we have a 2-year session in Mass, has been, I look at it as the session or the years of the women. When I first came in, I filed a paid family leave bill. I had filed one earlier, and I sort of did not file it the last 2 prior sessions to help focus on getting paid sick leave through, which we finally did and helped through a ballot initiative. So we do have paid sick leave. So this session, I refiled my paid family leave, and I'll get back to that. But I also was one of the 2 chief sponsored of the pay equity bill that we proudly passed in Massachusetts, which I think has become a model of the nation. Particularly one piece that I'm proud of is not being able to ask for salary history. That really perpetuated the situation. So that also was a coming together, of course, of many, many groups. And if hopefully you hear a theme, if you take away anything, it's that we need your voice. I mean, I look out here and I see some folks that I have worked with on these campaigns to get things through, and they would not have gotten through without the loud, persistent, consistent voices of so many individuals and so many organizations and groups. So I thank them. The other thing that I'm really proud we did, I had sat in on a group of a lot of CEOs when Deval Patrick was still governor, and the title of that organization, of that session, was Clearing the Path. And the discussion centered around getting more women on boards of directors in Massachusetts. The numbers are woeful. I won't even get into it. It's terrible. It's terrible across the country, but we had some control over Massachusetts. So I ended up working with some of the women's groups. We filed a resolution. It's non-binding, but to set goals for boards of directors in Massachusetts to increase the number of women. We know that boards are more diverse. The companies literally have a higher return on investment, so they profit. The decisions are better. Just everybody clearly benefits. And so I got Pat Haddad, the representative, who was actually the Speaker pro tem in the House, strategically asking her to co-sponsor it in the House, and we worked, and we did get it passed. And that has gotten some attention, and it did have a provision to move women up through management as well, so they could be prepared to be on the boards, and then also in other levels and on the state level. And then lastly, we did raise the minimum wage, which I think impacts so many women, and we hopefully will take that up again this year. But the one bill that I have to highlight that still blows me away that we still even had to pass was to prohibit the shackling of women prisoners who were in labor. Now, yes, that was still going on, and that alone says a lot, and to even have to testify to say, I can't imagine a woman in the throes of deep labor thinking, oh, this is a great opportunity to escape. It's just not going to happen. But we did pass that, and we're monitoring it. So these are things, and there's a lot of other things going on. But paid family leave, I'm really proud to be the Senate sponsor. We've worked a lot. The Senate did pass it. We ended up in the beginning of the session filing it. It made it through the Workforce and Labor Development Committee. It was reported out, originally went to the House, my bill as well, at which we had to do some maneuverings to get the Senate bill out. And then I'm the Senate Chair of Ways and Means. We were able to get it through the end of July, the end of the session. So throughout the whole process, though, we worked really closely with advocates, employers, and other stakeholders. A lot of the unions. There was a movement, the Raise Up Massachusetts, that helped the sick leave bill and minimum wage. Also got involved. But part of strategically, since we had done the pay equity bill and the women on boards, I think that for some people in Massachusetts, the feeling was, okay, we've done a lot. Yeah, I'll leave it there. And so we really wanted to, in the Senate, to sort of draw a line in the sand and say, this isn't sufficient. We need to do paid family and medical leave, even if it may need a little bit more work. Let's get it done. We did not think the House was going to do it at the last few days of July, but we wanted to be on record that we really support this and set it up for next session. So some of the things that we talked about was the amount of time, of paid leave time, the replacement wage amounts, how benefits would be provided, and who would pay. We do not have a temporary disability insurance fund. And I think that so far, and I may be wrong, but I think that all of the states that have passed paid family leave thus far have temporary disability. So it's a little bit harder, but clearly not impossible. And that's what I decided to do in our bill. We hosted forums and panel discussions, and the U.S. Labor Secretary Tom Perez came out. Deputy Labor Secretary Chris Liu came out and met with people. We met with a lot of the employers, and particularly some of the bigger companies, but some smaller ones, Google, Inkhouse, Spotify, and others, and really trying to impress upon the smaller employers, and particularly some of the employer associations that panic over anything that you add, to show how in the long run this will help retain employees, save money in the long run, and not cost what people think. So basically what we did was, in terms of the paid benefits, I selected, since we are doing this, let's do it well, and give 16 weeks of paid family leave, and 26 weeks of temporary disability leave in a benefit year. As of now, it would be the most generous. I don't know what would happen once the House hopefully does it and we end up with the compromise process, but I figured at least to start out, let's start out what we would like, or even a little bit more. There are the contributions. It does go through a trust fund, a disability trust fund that's created by this bill, and the contributions are taken on a percentage basis up to $118,000 of salary, capped at $1,000 a week. And it's phased in so that as the trust fund starts gathering funds and money, the amount up to that $1,000 increases. There are some things that we are still looking at and trying to figure out what works best for Massachusetts. At the very end, I did accept an amendment for a small business exception, thinking that might make it more palatable for some of the senators to adopt it, so we added that. I'm not certain when I file the bill again in January whether or not that will have it, or if we will end up adding something in the Senate or waiting for the House to add that. And I'm curious to hear what others have done and what works. I think all of you, I won't go into the benefits of paid family and medical leave. You all know it as well as I do. But it's something that I know for me, when I had my first child, I was a state employee. I was not earning very much. My husband had just started his own company. He was not earning very much. And I took several months off at no pay, and it was hard. It was very, very hard. And with my second child, I did the same thing. And I swore that if there was ever anything that I could do to help the path for other women, because it does make it a lot harder to continue the job and to continue, if you want, and to continue getting the experience and the skills to move up that ladder again if you want. We are making it harder for women, and I think that it should be open for women, men, whatever, for a broad definition of what family and purpose is. So any thoughts or ideas that any of you have, particularly if you're in Massachusetts, we are still taking suggestions and sifting through that, and as was mentioned, it's a work in progress. Thank you.
Thank you. finish with southern New England with Senator Beth from the state of Connecticut.
Thank you. How cool is that to have Elizabeth Warren lead us into this session? And you've heard from my colleagues in Rhode Island and in Massachusetts that we need you. And we need you pretty badly. And you can even hear from some of what we've been through that here 3 of us sit up, pretty senior legislators in our General Assembly, saying, this is really hard. And we even do things we don't want to do at the end to make it palatable. So I myself studied attachment as my graduate degree at University of New Hampshire. And I was involved in some of that research on the daycare wars between Kathy McCartney and Jay Belsky back in the 80s. And it was always the women saying, no, infant daycare is okay. And the men saying, what about attachment? If A equals B and B equals C, then A equals C. So I really come at this with an understanding of early childhood development. And when I was a new mother, I was running a daycare center at Trinity College. It was a community child care center. And I was having my second child. And she was born almost a month early. And I was a new director. I'd only been there 4 months. But I said, all right, I'm out. So I went home with my baby. And after 3 weeks, I called and said, I need a little more time. She was born early. And I had a ridiculous commute at that time. And they said, okay, well, either you come back or you're fired. And that was working for an infant daycare center. And I remember when my daughter was 7 weeks old, Chris Dodd toured the center, because this is how I got into politics. A third of my job working at Trinity was to be spent on advocacy. So, you know, Hillary Clinton came to our center when Caroline was 3. Chris Dodd came through to talk about paid family medical leave. They all knew we were there as their sort of spot. And I remember saying to him, you know, I have a friend who was told if she didn't go back to work, she'd lose her job. I never told him it was I. But I cannot tell you, and some of you probably understand, what it felt like at the other end of that phone. I had a career in early childhood that to me was social justice work. I started a parent co-op, the Durham Infant Center, and our job, daycare now I'm afraid like we don't understand what it is, but it's still social justice work. And back then we just understood we were women working for women so women could work. And we took it so seriously. So I didn't know what to do, but I had to make a living. And so I went back. Luckily, I was a director at that center. I could be where my baby was. I could nurse her and all that. But when paid family medical leave came up in Connecticut, I thought, we have to get this done. We need to work on this. So Connecticut has had, I think, a really challenging experience trying to pass paid family medical leave. But we do look to Rhode Island, and we were looking at what was happening in Massachusetts. We really need to build a movement that crosses states because the information does. Public hearings are about, here's what's happening in Rhode Island, here's what's happening in Massachusetts. By the way, after last Tuesday, I've always had this idea of seceding. I'm from Connecticut. I went to college in New Hampshire. If we could just take New York and New England, we would have,
all of New England.
We would have it all. California's too far away. But they can, then they'd become like a third of the economy. They would be a third of the economy if we left. But I think we do need to think of New England, that's what's so cool about today, as a sort of policy incubator, because we do have a lot of progressive ideas. We do have a lot of people who are highly educated who will fight. But we did not have the ground game that we needed to pass paid family medical leave in Connecticut. We did have the ground game to pass retirement security that benefited women. We do have all this research from people like Jack Shonkoff talking about the brain. What are we doing to protect these young brains? And what is that investment worth? But talk is cheap. I am so tired. I always say this at advocacy things for early childhood. Every politician says, oh, universal preschool, oh, this, oh, that. And then when it comes time to fund it, there's no money. Sadly, I was then appointed chair of appropriations. So now there's no money. And I can't fund it. The irony of that. But so in Connecticut, I think over the past several years, we've been working to pass paid family medical leaves. We've passed some important things. Like the first year we didn't pass it. We were able to put in the implementer, which is the budget bill, that we would fund a study to see how this could work economically, looking at models like Rhode Island, talking about how we could fund it. So that was great. And then the study came back, and it was, okay, so we've got the study, we can do it, but the budget situation in Connecticut has been very difficult. And so with each passing year, the Connecticut Business and Industry Association gets stronger and stronger as the economy struggles more and more. And so there was a huge business pushback. So they compromised and said, okay, we'll make it entirely employee funded. They put in a tiny percentage, I think it was, Donna might know the number, but it was less than 1/3 of 1%, 0.5% was a tiny amount, wouldn't cost business anything, and they still were crazy about what this would mean. And I don't think we made the case about supporting families and protecting those young brains well enough. And I think strategically there were a lot of good things. I think it was right to back off the first year and fund a study. But the second year, I don't think, given the budget taking so much space, we didn't have the power, a powerful enough push to pass it. Now, in the same challenging budget period, the GMO people were able to push, a GMO ban or GMO labeling bill. And I remember the Senate Majority Leader saying, oh, you don't want to get those women mad. Whoa, look out for them. They're coming for you. Everyone was afraid of them. But we couldn't build that same kind of energy around paid family medical leave. And in my time as an early childhood advocate, what I found, and I bet you guys will agree, is parents are so tired, they're just trying to get through, right? So they get through and they figure out daycare, and then they have a 5-year-old and it's like, whew, that's over. They don't go back and say, oh, now I've got to fight for infant daycare, and now I've got to fight for childcare subsidy, now I got to fight for paid. We're just like hanging on, right? Anyone feel that? We're just trying to get through. And you get through and you start to breathe again, and then your kid hits kindergarten, you start to have friends, and your life gets easier, and you go back. So we've got to figure out, how do we capture women? Number one, look who's up here. How do we elect more women? There are 7 women in the Connecticut State Senate. Please, a progressive state. We need more women there, and we need to get the women organized. Then what happens is we tried to organize, and some of the women on the inside weren't for paid family medical leave. And once everyone doesn't agree, it's like, oh, well, this won't be a women's caucus thing. So we need to be better at saying, okay, you two be ticked off, but we're going forward. And I would say the other error that was made in the movement, and I'm sort of talking on the outside because as chair of the Appropriations Committee the past few years, I wish I could say that I paid attention to policy, but it hasn't been possible because the budget has been so challenging. We've been able to sneak things in bills to help the cause, but I haven't been able to lead the cause. And I think the error that was made by the folks pushing it, was that they picked a leader who they thought, because you have to have a Senate president, majority leader, House Speaker, or somebody championing it at that level, or that was their idea. And they picked the same person 2 years in a row, who both times, when it got to crunch time and the Business and Industry Association said, oh, we can't do this, he's like, we can't do it this year. We'll do it another year, but we can't do it this year. I think Connecticut didn't build a wide enough group of supporters within the legislature, didn't have enough people feeling like if this fails, we failed. I should feel worse about it failing. I'm like a classic feminist child development lesbian organizer. I should be really pissed off this doesn't pass. But I guess I didn't feel bad enough. So I think we need to get this movement. I think the energy of someone like Elizabeth Warren, the energy coming out of Rhode Island and Massachusetts and hopefully New Hampshire, as we pass this, we've got to build momentum. And it's more important now than ever. Because, look, people are saying, well, this election was about the working class feeling left out. Let's give the working class paid family medical leave, subsidized child care. Let's give them paid sick days. I think we need to just build a movement and keep it going. So that's not everything I wanted to say, but I am done. So for now.
Thank you. I was just thinking when you mentioned earlier about a New England enclave, you know what we could do is look at the whole eastern section of from New England on up through New Brunswick, Nova Scotia, and PEI. They all have paid family leave. So we could become that part of the country.
Good idea.
Well, I'll tell you a little bit about New Hampshire. First of all, I do have to say that New Hampshire is now a purple state. I heard that yesterday, but it's very conservative. And I want you to know that it has the third largest English-speaking body in the world. The New Hampshire legislature consists of 424 people, and it changes over, 1/3 of that changes over every 2 years. Of the 424, 400 are in the House of Representatives, 24 are in the Senate. So it's, and of course we have no sales and no income tax. So New Hampshire is a very different state. And in 1996, many years ago, I was invited to run for the House. And so I thought, I came from Montreal originally, and all my friends who had had babies were on paid family leave and had access to high quality childcare and everything. I thought, oh good, this will be my opportunity to get into the state of New Hampshire and introduce paid family leave. Well, I brought for some of you who might be interested a chronology of what I have gone through in 20 years as part of a campaign to introduce paid family leave into the state of New Hampshire. The first bill I introduced was sent to our Labor Committee, and that's one of the things we have in New Hampshire. A bill can either, that speaks to benefits, can go to the Labor Committee. However, if you tack on the word insurance, it goes to the Commerce Committee. Well, the first bill went to the Labor Committee. Well, they had no idea what I was speaking of. And, but they did recommend that I do a feasibility study. So that, in fact, was what happened. And I was very fortunate, and I would urge you, any of you that want to start to build a paid family leave program, to be in touch with the National Partnership for Women and Families in the state of Washington. They are an incredible help. They have resources, and they are available to help you. And most recently, they published a wonderful chart that looks at a whole system of paid family leave. Well, they were very helpful to me, and they assigned a graduate student who was at the Kennedy School of Government to do the feasibility study for me. Well, that was all wonderful, didn't work. And then somebody said, well, New Hampshire doesn't have a TDI, a temporary disability insurance program. How many of you have mandated temporary disability insurance programs? Nobody. So, all right. So I said, good, I'll introduce that. The union said they would fight it because they wanted to use it as a benefit for union membership. So then we tried one more bill, and that was killed. And someone said, you know what, you need to do something else. You need to broaden your support. So I proposed a bill for a task force on work and family. And one of the things we have as an opportunity in New Hampshire is when you create a commission or a task force, you can decide who to appoint to that. So I had a wonderful task force in 2007, and we began to build support for a paid family leave system. We introduced one more bill that got actually quite a good reception from the Commerce Committee. It was an insurance bill, paid family leave insurance, and it was a good bill. It was modeled after the state of Washington. And the committee that heard it said, it's a wonderful bill. We can't pass it this term. We're going to recommend it for future legislation contingent on a cost analysis and feasibility study. So fine, we said, all right, this was the task force that, and that whole responsibility was assigned to the task force. So we got busy, and we went around to the various agencies in the state, the insurance agency, the labor agency, and so on. Can you do this for us? No, there's no money. So we applied for the first grant that was available from the U.S. Department of Labor. We also applied for another grant within the state, and they said it wasn't part of their mission. It was our health endowment fund. And we thought mental health and physical health are a big part of the need for a paid family leave program, but it wasn't part of their missions. So we applied for the for the first DOL grant, and unfortunately that application was denied. Reason being that we didn't have the support from leadership that we needed for that particular application. But then second year, along came a second opportunity to apply, and we did, and New Hampshire in 2015 was awarded $173,000 to really embark on a full-scale cost analysis and feasibility study. And Dr. Kristen Smith, who is here and who was the chair of the previous session on paid family leave, did that study, and the results of that study were remarkable. And as a part of our current campaign, we had a summit on September 21st in cooperation with the Women's Foundation in New Hampshire, and shared the information from the results of that study. And they are 82% of the people in New Hampshire, men and women, do support a paid family leave program. And every time I've gone to a committee or to introduce the bill, I will tell them that there are 3 countries in the world that do not have a paid family leave program. 3 countries. All the others, Russia has one, Cuba has one, all these other countries. The 3 countries are Suriname. Do any of you know where Suriname is? It's a little wee dot on the east coast of South America, just around Venezuela, somewhere in there. The second one is Papua New Guinea. Well, you know how big Papua New Guinea is on the map. They were discussed recently when that hurricane hit New Zealand. And then there's the United States. That's the 3rd country. And I would that didn't make any impression. And then I would also explain that there are states in New Hampshire that already have, in the U.S., that have paid family leave. And I would mention California. I would mention New Jersey and Hawaii and Rhode Island and so on. Well, that's not New Hampshire. So the significance of this study is very profound because it is New Hampshire. The data that came from this study is New Hampshire. So as a result of that, we are introducing a bill. I have filed a bill. It has quite a bit of support. We have in New Hampshire also, concurrent with the various activities that are going on in the legislature, a campaign for the family-friendly economy. This is a group that was funded by Rockefeller, and they have 4 areas that they are working on, one of which is to get a paid family leave program in New Hampshire. And they have been enormously helpful. They are developing an advocacy group to come in and support the bill when it is heard. They are also looking at alliances across the state, and I think you do need to look for groups that have sort of a similar mission or are willing to help. But they're also arranging meetings with groups like the Business and Industry Association, the Retail Association, all of those lobbying groups that tend to be a little more on the conservative side. So they are being very, very helpful in the campaign to introduce a paid family leave bill in New Hampshire. The other thing that we're doing, the bill that we have presented, we do not have a TDI system. So, but it occurred to me and to some of the others that the states that already have one have looked at what's going on in their state that we could align our bill with, or some of the aspects of our bill. Well, and you looked at the temporary disability insurance. We don't have that, but we do have unemployment insurance, and we do have FMLA. And all of our employers, well, the larger employers have the FMLA, but all of our employers have systems already to collect money from employers. So what we have done is we've talked with the Commissioner of employment security, and he is willing to be the administrative agency for the bill. He is the only agency in the state of New Hampshire that has the capacity to collect money, because we have no sales tax, we have no income tax, there's no other agency that collects money. So he is in a position to do that, and so we are aligning our bill and many of the aspects of our bill with what is already exists. So if an employer says, do I have to hire somebody else? No, you don't. You're already doing this. And the same thing with FMLA, although we are also, I mean, we're the bill that we're considering does not just apply to businesses with 50 or more employees and so on. So hope springs eternal. I'm embarking on my 21st year in the legislature, and I've been working on this since 1996. So we're hoping, and we do have strong support in the Senate. At this point, there's also some discussion. I filed the bill, but there's also discussion whether it would be better to bring it in through the Senate as the prime sponsor. So we've got some details to work out. But however it comes through, it will be just a joy, and I will be very pleased wherever I am. So those are our stories, and I'm going to open it up for questions at this point, because I do have some.
Pass those out?
Oh, sure. That's just the chronology.
Right,
Yes,
right.
sure. Yeah, you can. If anyone's interested, it's
That mic is cracking me up.
this one. Yeah.
This is for people asking.
Oh, okay. Questions. Questions. Don't tell me we're all tired.
It's a long day.
Yeah. Well, I guess I can think of a question. We mentioned some of the.
There's
Oh,
somebody
you
else.
have one. I'm sorry. Okay. All right. I didn't see you. I apologize.
So I work with the Fun for Women Girls, Fairfield County, from
Oh,
Connecticut.
great.
And I was wondering what the strategy would be, especially for Connecticut with a 50-50 split. How do we continue to move the family medical leave?
Well, in the last election, Connecticut Senate went to an 18-18 tie, but the lieutenant governor breaks any ties. So your big challenge this session is figuring out what committee to bring it through, looking at the counts on that committee. It'll probably come through labor would be my guess. So really targeting getting it out of committee, because if you can get it to the floor, you have an advantage if you can get all the Democrats. That said, there are definitely, Connecticut has very moderate Republicans on average. I think we vote together more than almost 80% of the time. So I can't imagine there aren't a couple of Republicans that might support it, and especially if you have a group in Fairfield County. You know, Senator Huang would be a target from my point of view, Senator Boucher, another one, and then you have Heather Summers, who's a new woman senator who's a Republican. So I think you need to sort of go legislator by legislator, figure out who's on your side, but really start by targeting the Labor Committee. And then last time AARP was really helpful, I think, for your cause. So you need the Early Childhood Alliance and AARP to sort of gang up. But find a younger legislator who has a lot of time, like somebody newly elected who's really gung-ho, you know, like when you started.
Or a young dad.
Or a young dad, yes. Yes, good point. I have to say, after the last election, I'm just all so focused on getting more women, and I think women who've lived this experience who hold on to it. So. I don't know, you guys might have suggestions
Yes.
about what worked. How'd you bring people on board maybe who weren't Democrats in your state on this?
Yeah, Massachusetts, in the Senate, there's 40 senators, 34 are Democrats. In the House, there's 160, and I think 132 might be Democrats. Although the Senate does tend, and those that are here from Massachusetts, I think will agree, the Senate tends to be more progressive, and the House needs sometimes more pressure and work. But I do feel, just like with the minimum wage in the past and paid sick leave, that there is a coalition that is sort of raising up and gathering steam. I do think that this year the two focuses of that coalition hopefully will be, and I think it will be, once again raising the minimum wage, and this time I hope for all employees across the state, as well as paid family and medical leave. I am not that worried about getting it through the Senate, being chair of Ways and Means.
It helps.
Yeah. And we do have the support. I mean, it was, I think it passed unanimously. I'm trying to remember, that everybody was pretty much on board in the Senate. But, the House is something, again, targeting, meeting with the Speaker and other folks and finding out. But I think also the businesses here in Massachusetts, their first reaction is, no, we don't want to do this. This is going to hurt business. So I think a lot of it, just like anything, is education and what can we do to help maybe bring, if not all of them on board, or all the business organizations, but at least some of them. And that's why, we may need to eventually put in a small business exception or, other things, but, to hear and be open to it. My background, I was a labor attorney and arbitrator mediator, so my background is conflict resolution. So, I think that like, anything else is a really major part of bringing people in. And even if you don't agree with them in the long run, at least they were heard. And I think that is a really important part.
Senator Goldin.
So, like Massachusetts, everybody is a Democrat in Rhode Island,
Oh, really?
but that means our tent is very big.
But we always think you're more
And-
conservative than we are. It's so
Yeah, well, that's because everybody's Democrat, so we have no particular caucus agenda, right? So I, it's not necessarily on party lines, but it is on ideology lines. So there were definitely Democrats I had to bring along with me because, unlike other states, Rhode Island, we don't really put a bill forward to the floor unless leadership knows that it's going to pass, and it's and that there are people who won't feel too uncomfortable taking a vote on it publicly and going on record on it.
goodness.
So that's kind of an oversimplification, but essentially that's what happens. So, so because of that, I really had to spend a lot of time talking to some of the more conservative members of the Democratic Party to share with them why this was important. People think because Rhode Island is employee-based that the business community wouldn't be up in arms. They threw everything at this bill to try and prevent it from happening, and is why there was a compromise shortening the amount of weeks at the end. They have continued to lobby in opposition and try to repeal, and it is 4 weeks of a law that already exists. So it is barely any leave, and the Chamber of Commerce has maintained this as one of their primary points, and they advocate against is to repeal the law. It is our Chamber of Commerce sent out a questionnaire for all candidates this year, in which, while running for office, this was a primary question on there. Like there were like 8 questions. Wow. One of them was, basically, would you repeal this law? So it's not quite worded that way, and you wouldn't necessarily know it if you hadn't been in the weeds on it. But there's a big old target on it. But the reality is, small businesses really, really benefit because small businesses can't compete with Google, and for us, that's, Brown University, which has this really lovely, robust paid leave policy. But for instance, Brown University, they employ administrative staff, they employ clerical staff, cleaning staff, graphic designers. They have a whole range of people. And so if you're a small business owner and somebody's trying to decide between a business that can offer you those robust benefits, and you really want to bring in that talent to your business, it is much harder to compete with that larger business. And so not only does this decrease cost for you overall, but it gives you an opportunity to just even remove this from the conversation because everybody gets this benefit. And for us, it's really been the small businesses who have been on the forefront saying, no, please don't, and that's really what happened in New York State too. It's really the small businesses who said, this is is something we really do need. And so when you think about who represents the Chamber of Commerce and who is funding that advocacy opposed to it, that is large corporations who easily can afford it. They just don't want something that appears to be mandate, and they can afford it in Rhode Island because they're not paying for it. So ultimately, it's about just anything that is a job mandate. I mean, this is the exact same arguments that were used against fire codes in the 1930s when people died in sweatshops. Social Security, everything is a jobs killer. So it's the same arguments no matter how you structure it. So you really just need to structure the thing as best as it will be for your workforce.
Hi.
Another
Hi.
question. Good.
Yeah, my name is Caroline, and I am a social worker. I miss you this morning because I end up in someplace else. I would like just to make a little suggestion. Miss Gile from New Hampshire, do you have a group of people who will be able, a group of women or a group of people who get together in order to support really in big weight any kind of bill that is saying no? If it's a good bill, why you don't have the support from people to be able just to get that? And New Hampshire is very well known in this country for elections and everything else. Now I hear Elizabeth Warren talking about we are in a bad situation, it's going to get worse. All we women have to get into the fact, and we have to get into that situation that we need to support each other no matter what and where we are. So we have so many people in Massachusetts who are so intelligent and big group. Why don't they go to New Hampshire and help you? And all the people in Connecticut do the same thing. All speak the same language. Why not we are able just to do the things in much bigger way, much supporting way, until you can see you build up there, okay. And thank you very much for being here.
Thank you. We'll accept any help we can get. But the answer to the question is yes, we do have the Women's Foundation. Prior to the Women's Foundation, we had the Women's Lobby, and they were very, very involved in a preceding bill, which had multiple sponsors from the Senate and both male and female sponsors. But that was the one that was recommended for future legislation contingent on a cost analysis. You know, someone brought up AARP. Is anyone here from the state of Maine? Well, yeah, I had a call from a friend who was a former legislator in New Hampshire who's now moved to Maine, and she said that paid family leave is being looked at by the AARP in Maine. And that is a group that is a natural group to form alliances with, because you mentioned earlier Rhode Island is 8th in the country in graying. New Hampshire is 2nd or 3rd in the graying of America. And that is a natural alliance to make. The other organizations are national organizations. I was looking at Chris D'Alessandro, who is involved with Moms Rising. And that's a national organization who have really taken on a lot of issues related to family and women's work and paid family leave. And so look to those groups, on the days when it's that you're down and nobody wants to listen to you because you're talking paid family leave again. And just go on the computer or talk to someone who is affiliated with these organizations, because they will be very supportive. Other questions?
Could I just make a comment, though, just as 2 sentences to follow up? When Secretary Perez came to Massachusetts and we went to a business and we heard from employees, there were 4 employees who had taken paid family leave, and they spoke. This was the reason they stayed at the company and so highly. They were all male. We can't forget our male counterparts as well, because hopefully the bills that we have, maybe not on a national level, but at least on a state by state, it will be for both men and women, and that is a really important part as well.
Yeah, and just one other quick thing that I think is something important for New England, because we are graying and because youth are leaving, one sort of tenet of my recent campaign is how do we attract and keep young people? Young people care more about quality of life than we did. And so, if New England was a place that they knew, paid family medical leave was part of the deal, it was part of the structure of New England, I think it makes them more likely. I mean, Boston is one of the only growing economies. I think Boston and New Haven are the only two growing economies and growing young people in all of New England. And I think Boston and Massachusetts, we can really use as a beacon, because when they throw the economic arguments at us, like in Connecticut, GE left and went to Boston. That was like a scourge. We still have the most Fortune 500 companies headquarters in Connecticut, but it was a big scourge. But it wasn't because of taxes, because Boston had higher taxes. And so, like, if Massachusetts can pass paid family medical leave and they still have a real thriving economy in Boston, that is something that we have. And I think Providence has the same thing, where it's sort of on the rise. And this isn't killing the economy. In fact, it's attracting and keeping young people. And we need to think about saying that all the time. We had this demographer come. I don't know if any of you were there at the Bank of, what do you call it, Federal Reserve Bank in Boston. And he said, New England better focus on attracting and keeping young people. So how do we make the economic argument? And we do need to bring men in. I'm just tired right now after the presidential election. But we need them.
Yeah, and there isn't, I don't know about the other states, but New Hampshire, workforce development is what is the topic for every meeting that I've gone to with the business community. They're very concerned. We can't find the workers. We can't find the skilled workers. Well, there's your, try some benefits. Try creating workplaces that will be attractive to the young people. New Hampshire is #1 in the exporting of our high school students to jobs and colleges elsewhere. Wow. #1 in the nation. That's not a statistic we're proud of. We had a question over here.
Hi, it's not a question, actually. I'm just going to remind those of you who were in the last session, and to tell people who are new, that there's a great opportunity on December 9th north of Providence to come together again and dig deep into all of these issues. There is a paid, New England only, paid leave forum sponsored by the U.S. Department of Labor Women's Bureau, and it will only be researchers, advocates, legislators. There will be some key people there, some of whom are here today, who will talk about issues unique to New England, like shared services, like commuting between states, and how we can form coalitions, and all of the issues that were brought up. So I really encourage you. I have contact information if you want, but please think about coming.
Thank you. Before we close, I first of all would like to echo what has been said. The campaigns for paid family leave in all states need your voice and need your energy. And they need you to advocate, and they need you to talk to your representatives, but they also need you to either write about it, if you're good at writing, or to respond to the people who do write about it. And I happened to go get my New Hampshire Business Review yesterday and opened it up, and there was an article by Joe Keefe, who is president and CEO of Portsmouth-based Pax World. It was a wonderful article on family-friendly workplaces are good for business. And he talks about paid family leave. And so now what we have to do in New Hampshire is write to Joe Keefe and say, that was a great article. It was in the New Hampshire Business Review, and hopefully, 2,000 people had an opportunity to see it. So I think our time is up. It's after 4:30. If there are no more questions, some of us can stay if anyone has any questions. Pardon?
I just had a comment.
Okay.
I don't know if it's working. It is. Okay, thanks. One thing, I think probably there was a lot of people in this room who tried very hard to get Hillary Clinton elected. And one of the things that we did was phone banking swing states. So why don't we adapt that strategy? Even our allies in Rhode Island and places that have already passed paid family leave, why can't we try to, make calls into Connecticut and other states like that, New Hampshire and so forth. So, and maybe that's organizations like Moms Rising and other national organizations that adapt that technology to make it so easy. I mean, for those of you who did it, like you could do it from home. Certainly some of us went to Democratic headquarters and that sort of thing. But I think we need to take that, yeah.
Or you can just tweet.
Yeah, I do want to. So I also work for Family Values at Work, which is one of the national organizations that works on paid family leave and paid sick days. And there are 24 coalitions across the country that are part of Family Values Work. All of the New England states have one. And so, this absolutely, it's the voices of Moms Rising. It is people who are connected in through Main Street Alliance, through their local coalitions, through all of those entities. And when they work together, they keep a resonating voice. Legislators like to hear from their own constituents first. And that is the absolutely most powerful thing. Even if you just call and say, hey, I really believe in this and this is where I live. That is absolutely, you would be surprised how few times people do it and how incredibly important it is in the process. But that doesn't mean that states around, people from other states in the country can't let us know that all eyes are on us. We have seen that with other movements, certainly in marriage equality. People called in, often if you identify in some way as a legislator that is connected to a more national, Jewish legislators, Greek legislators, whatever, you're connected up in some way, and that community is really vocal nationally to influence you to support it. That's also incredibly influential.
Senator Spilka, do you have any final words?
Just for the benefit of the questioner, because people should know this. In Massachusetts, we've been able to use the hub dialer, our coalition. So we make calls to registered voters. So we do one-on-one calls to registered voters, and then they get patched through to their elected. You could have people from out of state doing that, but you better have a good ground game, because it has to come from the ground. It has
to be
I go up to New Hampshire all the time, okay? And I'm happy to do it, you know what I'm saying? But you gotta have a good ground game, because at the end of the day, our electeds are responsible to the people that they represent.
That's right. That's right. Senator Spilka, any final words?
Just go out there and keep it up. That's the last thing to say. Just thank you all. Keep it up. Make sure your voices are loud and strong.
No. Thank you. Thank you very much.